Do you greet each day with a smile? Well, you can if you have the type of smile that lights up your face. So how can you make that happen? Joe Cronauer has an idea.
Well, on this lunch hour, we're spending some time with dentist Dr. Stephen Marsh, who's in his office right now. Doctor, I know you're probably hungry and waiting for lunch yourself.
Well, I am, Joe, because one of the things we do is we get here about 6:30 every morning. And so when you get up at 5:30 and you're at your office by 6:30, by noon, you're really hungry. So sometimes I have a banana or something. We have a little lunchroom during the day, 9:30 or 10, to get myself energized again.
Well, you start so early because it's not just about seeing patients, it's about preparation. Tell me about that, doctor.
Well, so one of the things we do early in the morning at 7 is we have a morning huddle. We go over our patients, what their needs are, who was in yesterday. We may need to check up on somebody and looking at the future. So that's one of the reasons we do it. And also today, in the days of COVID, it takes a lot to prepare our rooms, making sure everything is clean, sterile, wrapped, and we want to make sure it's safe for our patients and our team here. So all of that takes a little extra time. And fortunately, I have a group that's glad to get here as early as I do.
They're all in their places with bright, shiny faces each and every morning at 6:30. All right, doctor, let's talk about some of the patients. I love this side-by-side before and after pictures. Who do we have first?
And this is Terry. And one of the reasons I showed it, these are also people who like early morning appointments, get their day done. So Terry's wasn't very complicated. We often show these large cases where we've done a lot of work. Terry just had some teeth over the years that had turned a little bit. She had chipped some. She's in my age group. And I said, Terry, I think we can do this with some whitening. We use Zoom whitening, and then some reshaping of the teeth and a little bonding to give her that bright, beautiful smile. And I tell you, she's thrilled with the result in a very small amount of time.
I can see why. I can see why. All right, who's next?
So this is Andrew. Andrew, like Terry, didn't want a lot of work done. He said, I want to do it in stages. Some of it was time, some of it's financial. We did his upper teeth, not with veneers, Joe, with just bonding. It took about an hour and a half to give him that smile. For years, he walked around with the space, and he loved the result. The lowers, he said, I'll get to when I have a chance. We did a little reshaping. That gave him a better look, and it also allowed for the closing down and more room for the bonding. So very satisfying for him, and he got to work very early as well.
Well, you say it didn't take much, but boy, what a transformation for what quote unquote little you did. So that's incredible, really.
Well,
All right.
thank you.
Who's
Yeah.
next?
Okay, so this is an interesting story. This is Terry, another Terry, and it has to do with her timing. So we did 4 porcelain veneers. We did reshaping of the lower, though you can't see it in the after picture. What's very significant about this Terry is that I was at an Indians game on a Tuesday night. We had her scheduled for Wednesday morning at 7:15. And as we got up, my wife and I, to leave at about 8:30, a woman stopped me and said, "You're leaving so early? Oh my gosh, you're Dr. Marsh." And I said, "Yes, I have a patient." And she says, "That's my daughter Terry." So she said, "Oh my glad." I wasn't sure. Told my husband, I thought that was you. I wasn't quite sure. And I also noticed that you only had water with your hot dog. There was no beer. And I said, "Of course, because
Yes.
take care of my patient."
Well, there's no extra innings for Dr. Marsh, that's for sure.
Right.
All right, we have time for one more, doctor.
Yeah, and this is April. So April has her own business, a cosmetic business. She gets up very early. She said, "I can't take time during the day. Can you get me in early?" She came in at 7. We got started on her. We did some porcelain veneers, actually 8 in the upper. We reshaped and whitened the lower to give her this beautiful smile.
Wow.
And she sits right across the table, very close to her clients. So she wanted one that was very special. And I think we achieved that and still got her to work on time.
Without a doubt. So if you're an early riser or you just want to get a fresh start on dental care, call Dr. Marsh and his team at 440-461-1003 or log on to his awesome website. It'll put a smile on your face. It's clevelandsmiles.com. Doctor, thank you so very much.
It's been my pleasure. Thanks, Joe.